How do you know if you have insomnia and it's time to see a doctor? All the symptoms of insomnia can be listed as follows. You note chronic sleep deprivation lasting 1 to 3 months continuously. You have constant daytime sleepiness. You are haunted by nightmares and visions. You notice weight loss, lethargy, apathy, decreased sexual function, anxiety, and other symptoms. All symptoms increase depending on the course of insomnia. That is, it depends on an acute or chronic condition. Acute insomnia has a short-term course. It can occasionally occur due to various external factors. It can be stress, domestic problems, a change of residence, or a time zone. Chronic insomnia lasts more than half a year and is usually caused by severe illness, somatic or mental disorders. Polysomnography is the most common way to study sleep disorders. This examination is carried out by a somnologist in a specialized laboratory where the patient spends the night. While the patient is sleeping, various sensors simultaneously record the bioelectrical activity of the brain, cardiac activity, respiratory actions of the anterior abdominal wall and chest, the airflow that is inhaled and exhaled, and oxygen saturation of the blood are recorded. Thanks to this examination, it is possible to examine the state of brain activity and the work of the main body systems during all sleep stages to establish deviations and to find the cause of disturbed sleep. Most people treat insomnia as a commonplace syndrome, unpleasant but not fatal. However, there is a very rare but deadly genetic form of insomnia. Several dozen families around the world suffer from a rare hereditary disorder, fatal familial insomnia. These people do not sleep for months, exhausting their bodies to the limit, and eventually die. The curse of the Venetian family has become a kind of sensation in the medical community. When Silvano was struck by the family curse, he was on board a cruise ship. This elegant 53-year-old man with a mane of red hair loved to wear a tuxedo and imitate the grace of his favorite movie actors. But one evening in the dance hall of the liner, he found to his embarrassment that his shirt was soaked with sweat. Worried, he looked at himself in the mirror and saw that his pupils had narrowed into dots. His father and 2 sisters had the same glassy stare when their mysterious illness began. He understood that it would only get worse, trembling in the body, impotence, and constipation. But the worst symptom is the loss of sleep, almost constant wakefulness for months on end. Such a half-awake, half-coma eventually ends in death. Silvano eventually referred himself to the University of Bologna's sleep unit for further study, but he was under no illusions about the course of the disease. He told Dr. Pietro Cortelli that he would stop sleeping and be dead within 8 or 9 months. The doctor asked how he was so confident, and Silvano quoted his family tree from the 18th century by heart. In each generation, Silvano could name family members who had succumbed to the same fate. As Silvano had predicted, he died less than a couple years later, but he left his brain to science in the hope that it might shed some light on the strange disorder that had plagued his family. What processes take place in the brain and body of a person suffering from this disease? Scientists are only now beginning to understand this, and may have even found a medicine that can help the sick. But fatal familial insomnia is a genetic disease that is passed down from generation to generation, and the latest research raises a difficult ethical question. If, by virtue of the family background, a person has a chance to fall victim to this disease one day, should she or he be informed about this in advance? The Silvano family didn't talk much about their struggle with the disease, but about 15 years ago, members of the Silvano family spoke about the family's history to author D.T. Max. The resulting book, The Family That Couldn't Sleep, paints a compelling portrait of a Venetian family fearful of their own genes. Max tried to find the first sick person in the family and found out that family medical history can be traced back to a doctor from Venice who lived at the end of the 18th century and one day had a brain freeze forever. Soon afterward, the same fate befell his nephew, from whom the disease was passed on to his sons, grandchildren, and great-grandchildren, eventually affecting Pietro, Silvano's father. The latter died during the Second World War. Despite this series of deaths, the family tried not to discuss the disease so as not to tempt fate. But the situation changed in the 1980s when Silvano developed fatal symptoms. His niece was married to a doctor who convinced Silvano to see specialists from the famous Sleep Disorders Center at the University of Bologna under the charge of Elio Lugoresi. Pietro Cortelli worked there at the time. Scientists began to study the mysterious disease. They were unable to save Silvano and 2 other members of his family who died shortly after him, but as a result of an extensive program of experiments, they nevertheless found the culprit. It turned out to be an abnormal prion protein in the brain that had undergone a genetic mutation. For some reason, these prions began to multiply actively only when a person reaches adulthood, and they accumulate in plaques that poison brain neurons. Fatal insomnia affects the thalamus deep within the brain. This walnut-sized area in Silvano's brain looked like it had been eaten by worms. Disorders in this system can also explain insomnia in patients. Their bodies simply cannot properly prepare for sleep. Normally, blood pressure drops at bedtime, and for them, it remains abnormally high, as if the body still needs to be active. When the sympathetic nervous system is disturbed, of course, insomnia sets in, says Cortelli, who recently wrote about his findings in an article for the journal Sleep Medicine Reviews. On top of all, brain rhythms are completely disturbed. During the night, periods of REM sleep are replaced by periods of slow-wave sleep. Patients with fatal familial insomnia are constantly in the waking phase and cannot fall into deep restorative sleep, explains Angelo Gemignani from the University of Pisa. Patients with FFI cannot fall asleep. They only fall into a thoughtless stupor in which they unconsciously reproduce their usual actions. These patients seem to be dreaming. The doctor recalls a woman named Teresa moving her hands to comb someone's invisible hair. She was a hairdresser before the onset of her illness. However, there was also a man who achieved some success in his attempts to get rid of the painful stupor. When New York City psychologist Joyce Schenkane met this patient, Daniel, sometime after they met, he was distracted and confused during one of their conversations. He apologized for speaking incoherently and said he hadn't slept in 5 days, Joyce Schenkane recalls. A medical examination revealed that Daniel had fatal familial insomnia. His mother knew that there was some kind of hereditary disease in his father's family, but she decided not to bother her son with unnecessary details. The disease struck Daniel in an acute form and was supposed to be fleeting. He, however, did not fall into despair. He bought a motorhome and went to travel around America. He was adventurous and wasn't going to sit quietly and wait for death, says Joyce Schenkane. The symptoms of the disease became more and more serious, and first he hired a driver and then a nurse. Along with this, Daniel experienced as many different treatments as possible. He drank vitamins and exercised to keep fit, and also took anesthetics and sleeping pills, trying to sleep at least a little, if only for 15 minutes. Daniel bought a sensory deprivation chamber. Floating in warm salt water in an egg-shaped cocoon bath, he finally fell into a long-awaited sleep and could sleep for up to 4.5 hours. But upon awakening, terrible hallucinations fell upon him. For example, he did not understand whether he was alive or dead. Despite these relative successes, Daniel had regular flare-ups, which became increasingly more severe as the disease progressed. When these symptoms appeared, he could not do anything, recalls Joyce Schenkane. Sometimes a whole day fell out of his life because the disease consumed his consciousness. He could sit and have absolutely no desire to move anywhere, as if frozen in time. He once tried electroshock therapy to see if an electric shock could turn him off. It turned out that it could, but it led to such severe memory loss that it became clear that this method was less than ideal. After several years of fighting the disease, Daniel passed away. None of Daniel's treatments had any lasting effect, but this man lived much longer than people usually live with such a diagnosis. Joyce Schenkane points to a recent study that found that during slow sleep, cerebral spinal fluid circulates in the intercellular space of the brain, flushing out and carrying away toxins, as the beach is cleaned after a high tide. Perhaps if the patient manages to at least partially overcome insomnia, this helps to carry out such cleansing and slows down further brain degradation. To be continued in the next episode. Stay tuned.